Do you know what shingles is? Perhaps you've heard the term before, or maybe it's completely new to you. Either way, we're here to unravel the mystery that is shingles. This viral infection, often marked by a painful rash, is more common than you might think and can pose serious health risks if left untreated. In this enlightening conversation, we'll be exploring the ins and outs of shingles. We'll delve into the specifics of what shingles is and break down its common symptoms. We'll also discuss the causes of this infection and the complications it can lead to if not properly managed. But fear not, because we'll also be sharing some effective preventive measures to help keep shingles at bay. And if you're currently battling with this condition, we've got you covered with the most effective treatment options. So buckle up and stay tuned as we delve into the fascinating world of shingles. So, what exactly is shingles? Well, let's get into that. Shingles, also known as herpes zoster, is a viral infection that causes a painful rash. It's not a new type of virus. In fact, it's caused by the varicella zoster virus, the same culprit that gives us chickenpox. Here's the interesting part. If you've had chickenpox, the virus is still in your body. It lies inactive in nerve tissue near your spinal cord and brain. Years later, it may reactivate as shingles. Unlike chickenpox, you can get shingles more than once. The rash usually shows up as a stripe of blisters that wraps around either the left or the right side of your torso. Sometimes it appears around one eye or on one side of the neck or face. It's a sneaky virus, often starting with a headache or just the sensation of being unwell. Now that we know what shingles is, let's look at its symptoms. How can you tell if someone has shingles? The answer lies in understanding the 5 major symptoms that typically accompany this condition. First up is pain. This isn't your run-of-the-mill discomfort. Shingles often brings on a sharp stabbing or burning sensation that can be quite severe. This pain usually appears before any visible signs of the condition, making it a key early indicator. Next comes a sensation that can be described as burning, numbness, or tingling. This tends to occur in the same area where the pain is felt. It's like an echo of the initial pain, a reminder that something is amiss under the surface. The third symptom is sensitivity to touch. Even the lightest brush of fabric against the skin can cause discomfort. This symptom can make daily tasks, like dressing, a real challenge. Now we move on to the more visible signs. The fourth symptom is a red rash. This typically crops up a few days after the pain starts. Initially, it may look like hives or blisters, but as the condition progresses, it forms a band that wraps around one side of the body. Finally, we have the fifth symptom, fever. This isn't always present, but when it is, it can serve as a red flag that your body is fighting off an infection. With these symptoms in mind, let's explore the causes of shingles. But what causes shingles to occur? Let's delve into the 5 main causes of shingles. The first and foremost cause is age. As we grow older, our immune system's ability to fight off infections weakens, making us more susceptible to diseases like shingles. The second cause is having had chickenpox. The varicella zoster virus, which causes chickenpox, remains dormant in our bodies. Years later, it can reactivate itself and manifest as shingles. It's a bit like an unwelcome guest who decides to make a reappearance when you least expect it. A weakened immune system is the third cause. Conditions that compromise the immune system, such as HIV, can make individuals more prone to shingles. It's akin to having a fortress with a weakened defense, allowing the enemy to infiltrate more easily. Next on the list is undergoing cancer treatments. Procedures such as chemotherapy and radiation can significantly weaken the immune system, making the body a more hospitable environment for the varicella zoster virus. Finally, stress or trauma can also trigger shingles. Just as physical stress can strain the body, emotional stress can weaken our immune system, making it harder to keep the virus at bay. So, whether it's the passage of time, a past encounter with chickenpox, a compromised immune system, cancer treatments, or stress and trauma, these factors can all pave the way for shingles to occur. Understanding these causes helps us anticipate potential complications. What complications can shingles lead to? Let's explore the 5 major complications that can arise from this viral infection. Firstly, we have post-herpetic neuralgia. It's a condition where the nerve pain persists long after the rash has disappeared. It can be debilitating, affecting patients' quality of life significantly. Secondly, vision loss can occur if shingles affects the eye. This can lead to a host of problems, including acute retinal necrosis, which can cause blindness if left untreated. Thirdly, shingles can lead to neurological problems. These can range from mild inflammation of the brain, known as encephalitis, to stroke or even hearing loss. Next, skin infections can occur if the shingles rash is not properly cared for. These infections can lead to scarring and can be particularly severe in those with weakened immune systems. Lastly, shingles can present in multiple dermatomes or regions of the skin. This is more common in immunocompromised individuals and can be particularly challenging to manage. Knowing these complications, how can we prevent shingles? Can we prevent shingles? Absolutely. Here are 5 main preventive measures. First, vaccination. The shingles vaccine is a powerful tool, reducing the risk of developing the condition and the severity if you do. Adults over 50, mark your calendars for this one. Second, avoid contact with affected individuals. Shingles is contagious to those who haven't had chickenpox or the chickenpox vaccine. It's crucial to steer clear during the blister phase. Third, manage stress. Stress weakens the immune system, making you more susceptible. Incorporating stress management techniques like meditation or yoga can be beneficial. Fourth, maintain a healthy lifestyle. Eating a balanced diet, getting regular exercise, and ensuring enough sleep contributes to a robust immune system, reducing your risk. And finally, regular checkups. Regular medical checkups can help detect early signs and prevent complications. Now that we've discussed prevention, the question arises, if prevention fails, how do we treat shingles? Scene script. How do we treat shingles? We're glad you asked. There are 5 main treatment methods for shingles, each playing a unique role in combating the infection and alleviating its symptoms. First on the list is antiviral medicines. These are typically the first line of defense against shingles. Antivirals like acyclovir, valacyclovir, and famciclovir can reduce the severity and duration of the outbreak if taken early enough. Next, we have pain medicines. Over-the-counter painkillers and prescription medications can help manage the discomfort that shingles often brings. These may range from non-steroidal anti-inflammatory drugs to opioids, depending on the severity of the pain. The third method is using a capsaicin topical patch. Capsaicin, a compound found in chili peppers, can provide temporary relief from nerve pain when applied directly to the skin. This patch is usually reserved for persistent pain that doesn't respond to other treatments. Antidepressants also make the list. While traditionally used for mood disorders, certain antidepressants can also help with nerve pain, making them a valuable tool in the treatment of shingles. Finally, we have steroid injections. For severe cases, corticosteroids can be administered to reduce inflammation and nerve damage. It's important to note that treatment varies from person to person. What works best for one patient may not be as effective for another. Always consult with a healthcare professional to determine the most appropriate treatment plan. With proper treatment, shingles can be managed effectively. Remember, early detection and intervention are key to a speedy recovery. In conclusion, we've learned that shingles is a viral infection, presenting symptoms such as painful rashes and blisters. It's caused by the varicella zoster virus and can lead to complications like post-herpetic neuralgia and vision loss. However, it can be prevented through vaccination and treated with antiviral drugs and pain management methods. Remember, early detection and treatment can make a significant difference in managing shingles. Stay informed